Can you see in the top right corner?
I see me. Yeah. I didn't do my makeup this morning. You missed it.
Oh, and the host one, you mean?
Right, because we're not seeing that person.
I see. Okay, well, never mind. Okay, welcome. Hi, I'm Steve Bonoff, President of Printing Industry Midwest, and I could not be more excited to have this meeting. When I first started, I did a focus group of a number of our members, and there were two really critical issues that were brought up, amongst many others, but there were two recurring themes. One was the labor difficulties that our members have in really feeding the production personnel for their company. We tackle that in many ways, and you'll be hearing about more in the coming months with the launch of our new apprenticeship program later this year. But the other was taking costs out of the benefits and the healthcare elements of our members' businesses. It really is a drag on our members' ability to grow their companies. And so we have worked hard over the last year to bring this program to life. Now, it's not perfect. We'd love to have done a 5-stage solution with our own health solution. So we've done what we can do so far, and we've done it in ways that does add value to all 5 states. And you're going to be hearing about that today. Because I want to be clear, there's 2 elements to the programs that you're going to be hearing about today. One is, yes, if you're in Minnesota, 2 to 99 employees, we have a program that's going to be specific to your companies that we think is going to be better than you're going to be able to find on the open market. But whether you're larger than that, or you're outside of Minnesota, we also have solutions for you. We're going to be hearing about that through this morning's presentation. So I want to just thank the guys that are here today. Drew Engebrecht, Jason Sandler, Alex Sandvig, who is not here, is part of the team from Holmes Murphy. These guys have been tireless. You know, I don't have to tell you, this is complicated stuff. It's complicated to manage, and it's complicated to bring it to market in this kind of an environment. So we've jumped through a number of hoops because it's worth it, and I'm excited to have these gentlemen and this company as our partner, as I hope that you'll find as well. They're exceptionally receptive. When you have a question, reach out to them. I know you're going to get the answer. So on this morning's program, we want to make sure that you have the ability to be heard. And so if you're online, and there's the vast majority of you are online, chatting your questions is probably going to be the best way for you to be heard. So when you have a thought, just chat it in. Ben Daly is here. He's going to be recording those questions and passing them on to the team. At some point in time, we'll try to open it up as well if we can without the background noise and have you answer or ask your questions in person. But beyond that, we want to make sure everybody gets heard. And this is only the beginning. We're launching this. There's going to be a lot of questions to come. Please reach out to me. The website will be continuing to be stocked with FAQs that we've been compiling. Some of that will be even addressed today and answered today, and we'll be addressing all of that and answering those questions and getting that online so you always have a resource to get your facts and figures about this health insurance program. So I'm going to want to turn it over to Drew and Jason and let them introduce themselves and take it away. Thanks.
Great. Thanks, Steve. Really excited to be here. Again, Drew Engebrecht with Holmes Murphy. And I will say, I don't know that I've heard anybody nail my last name like Steve just did. I'm used to just being screwed up, L's, people think it starts with an I. It's just been all over the place. So thank you for that. No, we are incredibly excited to be here and talk about what everyone's least favorite subject probably is health insurance. So I'm used to being the least popular person in the room, so hit me with any questions, but hopefully today I don't have to be that, because we have been searching for solutions that I think can help groups of all sizes, especially focused on the groups under 100. But as Steve mentioned, we have solutions for all 5 states, no matter what your size. So we're excited to bring that to you today. So as Steve mentioned, he did some focus groups, and what he's hearing is not unlike something we hear all the time in our world. So things identified through the health insurance is it costs too much. We get that. You hear it in debates. There's a lot of things around health insurance and the costs right now. There's a lack of options. I don't have, there's only so many carriers. I can only be fully insured. What does my plan look like? There's confusion. We see it. We have compliance individuals that's all they do, because there's new laws that are heaped on day by day, and in the end, they fall on you as an employer. So we get that confusion, and then it takes too much time. Adding applications. What do I do in this case? So these are really 4 areas that we're really trying to solve through these programs. So just to kind of start with a little bit of history, Steve mentioned this is over a year in the making since we were connected through one of the PIM board members. And so they did a little due diligence, and another group of shared partners to really talk about who might be the best partner to help them through the process. And we're thankful, we are lucky that we were able to be with you today. So, after that, we went out to a couple different markets, major players in the insurance industry in Minnesota, Health Partners and United Healthcare. With Health Partners, they hadn't really built anything like that, so there was mild interest in getting something started. With United Healthcare, they have about 40 association health plans nationwide. Their home office is up here in the Twin Cities, but they really hadn't, because of some laws, they hadn't been doing insurance up in Minnesota until this past year. So they're hungry, they want to gain some market share, they have great networks, so we kind of landed with them as a great partner through that. And then through this, we've done due diligence. Steve has had some of the individuals and the board members, their groups submit some census so we could look at processes, look at rates, and make sure and really identify that this truly is the best solution. So in June, we signed an agreement to work through and launch an association health plan with United Healthcare. And what are our goals through this? The goals is obviously to fulfill a need to PIM members. That's first and foremost. Again, we've heard what your need is, and we're going to try to fulfill that. Create additional revenue stream for PIM. The work that PIM does for all the members we know is not for free. And so by engaging with United Healthcare, and some other things that we'll talk about, on our end, this can be an additional revenue stream for PIM to do work for you as members and lobbying, and in other cases to keep that going. And then I think, maybe first and foremost is to attract new members. Again, this goes to the, we all need to benefit, from PIM, and new members getting a part of this association can only strengthen the existing members. So those, in our mind, were 3 main things that we were looking to do through this process. So what is the solution? And as Steve referenced, there really is a dual strategy. In Minnesota, we were able to create a true association health plan for Minnesota members for, if you have 2 to 100 employees through United Healthcare. And we'll get into the details, but it will be underwritten by specific member. So there's some real benefits that go into that, through United Healthcare. And then there is a 5-state solution to really, meet or beat the market. And we'll get into a little more detail on that. But it's going to be, if the association health plan isn't a fit, for you Minnesota members, there's some other things that we can look at. There's, for members in the other states, this is going to be a solution, and really a technology-driven solution to help some of that confusion, to help some of that administrative, while also looking for the best options for you. So I want to dive into a little more on the United Healthcare AHP, Association Health Plan. So we love acronyms in insurance. So if you have questions, UHC, AHP, COBRA, HIPAA, all that stuff. But we're going to focus on the Association Health Plan. And just to hit some quick facts on really what this is. So this is for the under 100 market. If you have under 100 employees, and you're in Minnesota, you are eligible for this. Again, it's going to be by specific members, so it's not like company A and company B are going to have the exact same rates, because they're going to want to look at you separately on a separate basis. We did want to make sure that everyone had access to the proper plan designs. We know that making changes in health insurance is difficult, and we don't want to move you if you have a really rich plan to a not rich plan, or vice versa. So we do have a lot of different plan design options, and it is a national network. We know that, you have people maybe all over the state, all over the country, people are traveling, and they're gonna have options, and they're gonna have coverage wherever they
There we go.
are good?
Am I back?
Just in case.
Okay.
And I'm sure what everybody's excited about, reduced cost. Through this, we've negotiated some reduced costs through United Healthcare. So, these are going to be cheaper than you could get with United Healthcare on the open market, which we're really excited about. And then if you have a group, if you have less than 50 employees, many of you are on what's called the ACA plans. And these came about in 2010, where it really took a lot of the health out of health insurance, and you're really rated in the whole big pool of employees, and it's really just based on demographics. And the big piece is that it's all age rated. And so going back to administrative time, a lot of employers, see a bill and there's 20 different people with 20 different rates. And how do I figure out what my contribution is? And okay, my bill went up because I lost a 25-year-old and now I hired a 45-year-old. With this, it gets you out of that age rating and gets you to the old composite rates. So you can have a single, employee spouse, employee children, family. For a lot of groups, that is a big deal and can be a big time saver. So we're excited about all these things that can come through the AHP. So again, who can apply? Obviously, you have to be a PIM member to get the insurance. But I tell you, if you're online or if you're just someone interested in becoming a PIM member, send us your information. If it looks good, that might be a great reason to join PIM. Again, under 100 eligible employees is what you'll look at, and it's whether you offer health insurance or not. There may be some smaller groups that say, I can't afford it, or the ACA rates are way too high. Still, get information, and we can see if there's a viable option for you. So now to underwriting. So again, this is a look at the ACA and the age rating versus this program. With United Healthcare, for small group, this puts the health back in health insurance. And so they're going to really look at the health and the demographics of your group to see what that proper rating should be. And we'll talk about administrative ease with some of this, but depending on your size, there's different underwriting that goes into that. So if you're less than 20 employees, it's going to be the health applications. So again, go back to the Wayback Machine. And you're under 20 employees, you probably remember those days. and each individual will have to fill out a separate health application. United Healthcare will take a look at that and see, gosh, if this is good risk, yes, we want this, and we think it's going to be a lot, more reduced costs than the ACA. If you're 20 to 50 employees, it's going to be a little easier. United Healthcare, and many insurance companies actually, utilize a system called GRX, which essentially is a pharmacy database system. And you may or may not know that all of our information is out there. So what the insurance company does is they'll get, a look at your census, everybody on the census, and they're able to see what drugs people are on. And from there, they have their actuaries kind of extrapolate and say, gosh, there's that heart and that blood pressure drug. That probably means they have high blood pressure or heart disease or insulin, diabetes. And so they're able to really back into that and figure out, health conditions based on that. But that means no health applications. So it's a lot less work on that end. And then we were also able to negotiate, groups 51 to 100. Now, most times United Healthcare and their association health plans, they stop at 50 employees. But through some negotiations with PIM, they said, okay, we will allow groups up to 100 into this as well. Now, the underwriting's done a little differently, actually kind of probably similar to what you're used to right now, in that there'll be census information, any claims information, aggregate that you get from the carriers, any large claims, that's all taken into account, and we work with United Healthcare to get those. So really it depends on size, and we don't want this to seem very difficult because we have a lot of administrative pieces in here to really help you through this process, which we'll go through. So a little more on United Healthcare. And let me ask, anybody in the room, is anybody with United Healthcare? Again, they're newer to the market, so that makes sense. But since you're not, I do want to put you at ease. Obviously, they're a large national player. They have, through this, we have 10 different plan design options. We have some traditional plans, and those range in deductible anywhere from $500 up to $6,350. So, whether you offer a uber rich plan or what we call a minimum value or a bronze plan, we have you covered there. There's also some HSA options. Many groups have health savings account options, and we have several that you can choose from on that. So we think we took a big look at this, and usually, associations, they say maybe 6 to 8 plans. We're able to work with them to get 10 different plan options in here. And then the big one, the Choice Plus National Network. In Minnesota, what United Healthcare came in, well, if you're familiar with Medica, has almost every provider in the state. Well, United Healthcare had a handshake agreement with them prior to that, and they really went in when they got the go-ahead to sell insurance in Minnesota, and they negotiated and contracted with all those same customers. So I think they have about 97% of providers. So I really don't see any issues, especially in the state of Minnesota. And United Healthcare is the largest national network out there. So again, you're traveling, maybe you're lucky and you're a snowbird, you're going to have access, you're going to have coverage. Mayo is a part of the network, which I know is a big deal. So there's going to be coverage for you everywhere. So we've crossed those T's. We've made sure that there's no issues around that. So really, what are the advantages? Again, we've kind of hit on a few things. Reduced costs. United Healthcare, they are getting a large bite of the apple. They are getting access to all PIM members. And so as a part of that, they've said, yes, we're going to bring down our administrative costs, anywhere from 5 to 10%, depending on the group. So, going, directly to United Healthcare versus through PIM, you're going to have access to reduced costs. We're also excited because this is really a test market. for them. So we went a little bit into the history, and it sounds like setting up an association health plan should be so easy. You know, hey, we've got a bunch of groups. We want to offer one health insurance plan, health insurance carrier. Do you want it? Sounds like the way it should go. As Steve knows and has experienced, it's not that way. There's a lot of legal that goes into it. You know, I think both he and Holmes Murphy have spent, you know, time and dollars on legal cost to set something up. One of the issues is that there's different laws state to state. And so, you know, with United Healthcare, we've negotiated and said, okay, let's use this as a test. And so we're hoping to get a lot of traffic, a lot of opportunities. And if we can grow this thing, they've said, gosh, if this works, yeah, let's grow this. Let's look at the Dakotas. Let's look at Nebraska. Let's look at Iowa. So we do have that commitment that they will, you know, they will see how this process is going and potentially grow from there. And then I'll point this back again, you know, really exit the ACA world. You know, with the Affordable Care Act and the age rating, there are always winners and losers. If every 35-year-old in the Twin Cities area has the same rate, you know, that means that some should be lower and some should be higher. And so we're giving you the opportunity, if those rates should be lower, to be rewarded for that. And so that's why we're excited. You know, there's going to be some that this plan isn't right for. You know, maybe it's the health of the group. Maybe it's the age of the group. It just doesn't make sense. We have a great landing spot for you behind there, but we want to at least put the opportunity out to save some time, save some efficiencies, and mostly save some money. I'll stop there. Ben, I don't know if there's any questions online.
Nothing right now.
Anyone from the room? I know this is a lot of information. We're all excited. We're all in. We're all in. Okay. So if we're all in, how do I get a quote? How do I start this process? Well, and I'll turn it over in a minute to really the technology piece of it. That's going to help. It's through Ben Portal, and this is a solution that we, Holmes Murphy, have developed over the years as a way to help on the intake side, save you a lot of time, help through that whole process, and then on the back end, it's going to be an employee-facing online enrollment tool as well. So it has a lot of different functions that we'll really dive into, but we have set up a website and a hub that you can visit, and you can go and upload your census to really start that process. And then diving into the technology part, and really part of that dual strategy. So we've hit on, you know, piece one, you know, United Healthcare, the AHP, it can get me out of the age rating. It can reward me for my good health, and it can get me, you know, access to reduced cost and a national network. Those are all awesome things, and we hope like heck that you fit that bill and it works for you. But again, for everyone, it might not make sense. You know, it might be that my group's not healthy, and United Healthcare is not a fit. It may be that, you know, I need more options, or gosh, maybe I like a different carrier. You know, I love Health Partners. There's nothing wrong with that. We have some fallback options for you here as well. In the end, what we're trying to do on the small group side is to make it simple, make it competitive, and make it fair, which those things don't sound like health insurance. Am I right? So what else, this Ben Portal, what else can it really do for me? So again, this is going to be your hub, to quote the United Healthcare AHP. We're excited because it's also going to be the hub and we're going to be able to show you other insurance options. We're going to be able to scour the market for you. Just knowing there's a lot of carriers out there. There's a lot of different funding arrangements, and you may not know all of that. You may not always see or have access to all that. So part of our strategy is to really blanket that market and make sure you find the right fit. We mentioned the electronic intake, and again, Jason Sandler will be here to show you really what that looks like and how easy it is compared to really the old school methods. And then going along with that, applications. We know, dealing with a small group, health applications, I think half the time people didn't just stay with the carriers because they didn't want to deal with it. It was hard collecting all of them. I had to have 3 different applications for 3 different health insurance carriers. You get the applications. I can't read Bob's social security number, so I've got to go back to you. It was just a nightmare. So we are taking the complication out of that and making it a whole lot smoother and easier for you. And then we have a whole team behind us. So you're going to see a quick turnaround and those options, hopefully in your lap in days. There's also going to be some savings off ancillary costs. So a lot of this, we're talking about health insurance because that's the #1 cost when it comes to benefits. But through this technology, we've negotiated savings and enhanced benefits, on the life insurance, on the disability, if you have worksite benefits, dental, all through this portal. Things that a lot of small groups, wouldn't be able to get, wouldn't have access to. This is all through this portal. So even if the health insurance isn't, you don't find much savings there, there's going to be some potential savings on this side. And then the last couple pieces, online enrollment. This is something that we're seeing a lot more in the market, but it's mostly larger groups, and there's costs to it. So through the partnership that we have, this is something that's going to get to you at no cost. So after we have gone through the process and, United Healthcare or one of these other options you choose, we give this technology to you. Your employees can enroll online for all their benefits. We build a specific website for you, and then you keep it. Your HR, your administration throughout the year, they can make changes in there. Back to, on slide 1, administrative ease and time. That was a concern. This is something that's going to help that as well. So we're excited about this. And again, this is something that you in Minnesota are going to have access to. You can quote all the options, including UHC, through it. And then, for the other partners in the other 4 states, they're going to have access to all of this as well.
Great.
That was just a teaser. He's the technology guy. He's going to walk you through that.
Well, thank you, Drew. So good morning. My name is Jason Sandler, as Steve introduced me a while ago, and I've been sitting here trying to drive this computer. But yeah, I think Drew set the stage and kind of gave you a really good lay of the land, especially the unique offering that we're able to provide in Minnesota. But I just want to kind of level set on what we're able to deliver through our platform, and then we'll demo, how easy it is to engage with us, to start the process, and then what the employee experience is. So very first, I think that every group, regardless if they're domiciled in Minnesota or one of the other states of PIM, will gain an efficiency, a simple process, not only for the employees, and we'll showcase that, but also from the employer managing all of the tedious paperwork. And I know you guys are in the printing industry and we love paper. We're not trying to say that paper is bad, but on managing the health and non-medical benefits, driving efficiency, where employees are entering their information online and digitally signing everything, it just creates a whole lot of efficiency. And Drew mentioned the back and forth of handwriting deciphering, or maybe there's no handwriting deciphering and someone enters in their wrong date of birth, a social security number, then they go try and use the insurance and it doesn't work. So that's what we're able to do, is bring clean data in a very efficient process. I'm actually a doctor solely based on my handwriting. Never gone to medical school, but I can't even read my handwriting by the time I get to that third application. So driving that efficiency. The second piece is the competitiveness on the non-medical benefits. In almost every situation, we're able to offer better underlying benefits and cheaper rates. And so a couple of examples on voluntary life, we can get down to 2 lives. So if you're a really small group, $100,000 on a guaranteed issue basis, no medical underwriting, so no health history. If you're 30 employees, that may be table stakes for you. For dental, we have dental coverage that has implant coverage, no waiting periods, down to 2 lives on a voluntary basis or employer sponsored. So bringing great underlying benefits, with great pricing on the non-medical benefits. And then the third thing is, without paying a penny more, we can offer the same insurance that you have today. In some cases, better plans or better efficiency and better pricing for the groups that qualify for the United Healthcare solution or some of our alternative solutions. So we're driving that efficiency, the competitiveness on non-medical, and then, without paying a penny more on the medical, those options. We do have a strategy that we're helping companies with some recent legislation. When the group plan does not fit their budget anymore, or maybe they're not able to offer it, there's a way to drive efficiency, tax efficiency, to give allowances to employees to go purchase individual coverage on the individual market, and drive that where it counts as a business expense for the employer. It's tax-free dollars to the employee to go purchase individual policies. And through our partners, they're doing this through an online exchange where they have access to the same plans they get on the public market by themselves, but also in some markets, some unique offerings that they can't access anywhere else. But a streamlined approach to be able to manage those reimbursements for you as the employer. So we call it meet the market is the community rated worlds where the rates are the rates. The beat the market is the AHP type offering through United Healthcare or some other alternative offerings where you qualify based on the health history of the population. And then retreat is where, if neither one of them meets your budget, an option to give tax efficient dollars to employees to go purchase individual coverage. So this is a picture of the landing page. So if there's some marketing efforts, you'll be getting emails, or if you want to engage, you're going to go to this website. And I'm actually going to go to the live website. So give me a second as I shift over. Let me go here. All right, so I'm at the website for the printing industry Midwest. As you can see, it's branded PIM Midwest. So if you go on here, you'll know that you're in the right place. And I'm going to show you guys, there's a lot of great content information. And as Steve was mentioning, there's going to be some FAQs added to this. And that FAQ is going to be a moving list. So I think it's 2 or 3 pages today. And as more and more questions, as we learn more and more with this unique and pilot program with United Healthcare, we'll keep on expanding on those. So that's something to be able to access at your fingertips. But I'm going to show you, I'm an employer, and I'm going to come into this platform, and here I am entering a test group. And I'm putting test on here, and I'm going to pretend I'm 2 employees, and I'll show you how the system will work. Because if you're under 5, there's one method. If you're over 5 employees, another method. So I've got my company, I put my company name, number of employees, my contact info, and I go to the next page. Whoops. So I put in my address, and this is I did as quickly as possible. I am based in Dallas, so I'm a little bit cold up here. But so all this information with the red asterisk is required. When you get to something like SIC code, you'll see there's no asterisk. So SIC code is going to be a 4-digit code. If you don't know what that is, no problem. We can look it up for you. You can also engage with our Ben Portal team by clicking this message button. And if our team will respond via message, you can request a meeting where you get access to our calendar, you get a 10-minute huddle. We can also expand that longer if necessary. And then a phone number. So if you get stuck on something, just keep on moving forward or engage with us at any stage in this process. All right, so the specialized offering through United Healthcare is the earliest effective date is January 1st. So you put the effective date that you're trying to accomplish. Some groups may be a December, so we can look at everything in the market for December except for that AHP in United Healthcare, Minnesota. You put your effective date. and then you move to the next part. Are you currently a member of the association? Yes or no. If yes, you put your number. If you don't know it, no problem. You check the box. We've got access with Steve, and we'll verify that with groups as we get to before we engage on the final process. All right, so we're getting a little bit more information. A lot of this was pre-filled in from the first page, but so I'm going to move forward. All this information, whether you're the business owner, you're acting as HR, maybe it's an office manager handling this is all information that they would have at their fingertips. So now you get to mark if you have coverage today. So yes or no. So I'm going to put yes. And if you don't recognize any of these carriers, no problem. You can come here and put other, and we'll use health partners. So I've used it before. And then, what kind of coverage do you have? Fully insured or self-insured? So most companies, for the most part, are going to be fully insured. If you're not sure about that, we can click over the icon, tell you a little bit about it, engage with us. We can help you identify if you're fully insured or self-funded. And then I'm moving to the last page. So this last page is where you're going to add your census data. If you're under 5 employees, you're going to manually add it like this. And I imagine most of you guys are going to be over 10. So you can just kind of get a feel of what the information is that they're looking for. Whoops. Excuse me, we're collecting hours, and the primary reason behind that is identifying in your industry and in many other industries, there's a lot of labor force that's part-time that's not eligible for benefits, but we need to capture those employees to understand what market segment, what underwriting method that would be needed. So we're capturing that information there. I'm going to make myself a little younger today. Drew mentioned 25 years old, so. Okay, so I'm just going to put myself as employee only for sake of time, and I appreciate you guys bearing with me because I am not a good typer and talker at the same time. All right, so added myself. I can go edit, I can remove, I can add a dependent, but I'm going to add my second employee.
I thought you were going to try that last name.
Yeah. And the good news is, even if I make up an email, it works. And Drew works 40 hours. He's a male too. I don't want to tell everyone your real age, Drew. All right, so so this is the manual process for groups less than 5 to add the census. We've added the 2 employees. Now I'm at the final stage of this process, and I've got my company info, the current carrier. I am a member of the association. There's my number, and this is my census. So now you have an idea of what I just put in. So if I say, oh, I actually have 3 employees, this is a good way to catch that. If I had 2 employee only, 6 employee spouse, 5 children, 5 family, I'd be able to see that there. And now I just hit this final stage. Our team will get an email within the next few seconds. Looks like my internet's unstable. And then we start engaging in the process. What I'll show you real quick is how it closed. Let me see if I can just pull up. This will load real quick. And you see this email just came through. So I just got an email. There's 2 emails I get as I go through the stage. The first process where I enter the first page of the information, and then when I submit it. So my Excel somehow closed out. So I'm going to, okay. Here it's back now. So we've got a template, and this is not the right one. I'll try and get it in a second, but I'm going to move on to the next part of this. But the census has a key, so it'll tell you exactly the information you need. Don't get hung up on that. If you don't have that information in that format, you got a different format. There's all those different ways to connect to our Ben Portal team. Request a meeting, chat, or call us. You can send it to our team, and we'll merge it into the right format. So I'm going to show you guys what the employee experience is.
You were talking about dependent level census with that. So that's what you'll need. Yeah, so dependent level census, and it's probably something familiar for you that have coverage today. Dependent level census will be the list of employees as well as their dependents. And we'll need their name, their date of birth, their gender. We'll need the home zip code for the employee. And then if they're active, full-time, part-time,
if they're on the plan via COBRA or continuation. And our census has a key to help do that. But if you're generating a census to with your current relationship to go to market, you have that at your fingertips. So just send in their format, we'll massage it into the format that we need.
Jason, another question. To count employees, do they include non-eligible part-time employees?
They do. So there's a few different counts that go into this. A couple of the counts are going to be related to what market segment they're in. And then the other count's going to be what underwriting segment they go in. And so it's going to require what's called average number of employees. And it's going to go on the previous calendar year. So previous calendar year. So for 2018, how many employees received a paycheck in January? How many received a paycheck in February, March, April, May? And then you divide that over 12. And now it's going to decide on what your average number of employees is. Then there's another count that figures out your full-time eligible employees or equivalent. So if I've got 20 employees that are full-time, that's 20. If I've got 10 employees that are part-time, so let's just say for easy math, they all work 20 hours a week. I'm in essence, I've got a total of 25 employees. And so those numbers will help request the necessary information to understand which market segment to go in, what the underwriting methods will be. If you're going to be doing the individual apps, if you'll be doing the GRX underwriting, we just need the census. So we'll help identify that.
So that formula that you just described, that's going to be in our FAQ that we're going to publish?
Yes.
So people will have reference to that.
Yeah.
Figure out how to map it all.
And we've got some a worksheet as well for the average number of employees. And so instead of putting that burden on the employer to have to do the math equation, we'll help them through that process. So I'm going to show you guys what the experience is for an employee. So I am enrolling on my benefits for the very first time as a new hire. As I'm typing my password, if I can type the same password twice, you'll see that this is branded with the company logo. And then there's a waterprint of the same company logo. So this would be specific to your company. Companies provide us a picture of their company holiday party. We've got different images that we can put if they've got multiple logos, a color one, a non-color one. But this is going to be branded. So if I'm a new hire or I'm an existing employee and I'm going through open enrollment, I'm going to be coming into a portal that's customized for my company. It makes me feel good, even if I'm down to 5 employees or 20 employees, I'm getting big company technology down to small companies. So I am going to start the process.
While you're doing that,
yes.
Just another question. Do we include union employees who have union insurance in their employee counts?
That's a great question. I think it depends on how they're set up from a union standpoint. Actually, I've been engaging with a current group here in the Minnesota market that does have union employees, and the union employees do not count against or does not count into their market segment based on how their contracts are written for those union employees. They're not eligible for benefits, and they don't count to increase their volume of employees for market segment. But if it's a different way, so we would engage our compliance team in United Healthcare to make sure we identify the right land size. We have to know how those union employees are contracted.
Very good.
Yeah.
Just like everything in compliance, it depends is the answer. And as Jason's typing, I just wanted to jump in again. We showed you how to input your information. Now this is, hey, we've made our decisions. This is great. We're kind of, we're going forward. Our employees all get this. The in between, that's what we work with you. We have a team behind you that's going to give you your United Healthcare AHP options. We're going to look at the ACA or other markets to see what the best fit is for you. So there's a lot of connection, a lot of discussion that you're going to have with us and our team, just like your normal relationships. I mean, we're there to help, to consult, and to kind of walk you in the right path. So I didn't want to miss that. We're trying to make sure that you get a full feel for what this system is, but just know that there's a lot of hand-holding that goes in. We have a lot of people on our team that are dedicated to PIM, this project, to make it work.
Keep on talking for one more minute. Is there something that?
Okay. Yes, question.
You said that January 1st was kind of the first eligible. Do we have enough time to make something happen effective January 1st?
Yeah. The question was, we said this is launching January 1st, and do we have time? And the answer is yes. We'll have to to get going soon. But yeah, we have our team. Hopefully the turnaround is going to be shorter than you're normally used to. Obviously, it depends on the size of the group. Like we talked, your 80 employees, so we'd need some of that claims information and other things, but we still would have time.
And then what does the open enrollment look like? We've got about 50% of our employees, English is not their first language.
Mm-hmm.
And so if they're interpreters, how can you come out? How's the education?
Yeah, and Jason, he'll hit on the technology side. I think it can be what you want. We have, some internal, as Holmes Murphy, we can come with some interpreters. There may be some materials that we can come up with, for non-English speaking. And Jason, hopefully, I think the key, that information can be in Spanish as well.
Our
right?
system,
Our
Spanish. System can do English or Spanish, and it can be decided at the employee level. So they can click a button, convert it to Spanish on the spot. Because we find a lot of employees are embarrassed to say that they are Spanish speaking in a group audience, but when they get on, they understand and interpret Spanish better. So they can get in English or Spanish by clicking a button, and that way we don't have to designate you're only Spanish, you're only English.
Yeah, and there, as a part of this, I know we talked with Steve at the front end. Communication and materials, Holmes Murphy will help put those together as a piece of this.
So what is the timing of the open enrollment to be able to have their cards by January 1st?
I would say it depends. No, usually with most carriers, if you get all decisions made, including people signing up by about the 10th of the month, you should be good. Even if they don't have cards, if you get it by the 10th, everything will be in the system, and we can work to get temporary ID cards or memos, member information out to them. We've done that before with other carriers. And actually, and I think Steve will agree, we wanted to start this about a month or two ago. We've just been, again, in the insurance world, sometimes carriers kind of drag their feet on some things. So this is first launch, and we're doing that because a lot of groups are January 1st effective dates. But if you're a February, March, or you want to take a look in February, March, there's still opportunity for you to do that, because in the insurance world, you sign it's a year contract, but you can change that at any time.
Drew, what's the process? Because someone did upload their census data on the 24th and hasn't gotten a response. So I'm just, it's out here, so I just want to bring it up.
Yeah.
I know that this is a new, so processes are just getting in place. What is the normal time frame that people should expect?
Yeah. Well, and Jason, you can jump in here as well.
Yeah,
I'll let you take, because that's your team is kind of heading that part up.
So normally, and we'll have to look into that so we can take that offline, Steve, but typically someone's going to come into the portal within 24 hours. They're going to hear from us where we reach out. Thank you for some information. We're going to learn a little bit more what they're offering, the way of benefits. So they indicate they're with health partners, they indicate with Medica. Want to make sure we're showing more apples to apples. As Drew mentioned, there's 10 plans available on the Minnesota AHP, but as all the other carriers, there's even more options, and we don't want to show them a $500 deductible when they're used to a $5,000 and vice versa. And then from there, we'll go to the market. We are the United Healthcare AHP is taking a little bit slower. We just gained access to it late last week, and it's a more manual process than we had hoped, which is fine. Our team is equipped to do it, but we're typically getting back to the group within 72 to 96 business hours of here's your current situation, here's what the market bears. If there's delays, we'll typically reach out and say, hey, we need an extra day. We ran into this issue with United Healthcare. Now the underwriting part with United Healthcare, we've got 2 groups right now in that, and it's taking a little bit longer than we had hoped. And I think they just released this last week themselves. So that may take a little bit longer, but we'll give them the best case scenario with United Healthcare to see what that looks like. So typically 72 to 96 hours, but they should hear from us within 24 hours via phone call.
And Jason made a great point, kind of talking about, best case scenario. With the United Healthcare side, they're going to do the initial underwriting based on demographics. And so you can see, okay, if before we do any applications, before we go to the GRX, before we submit our claims, this is what United Healthcare is saying. This is where we see your demographics, and if everything checks out, this is where your rates, could be. If that's more than the ACA market, we don't want to waste your time with that. So we're going to get that on the front end, have a conversation with you, and make sure that there's as much transparency as possible. You understand where we're at, and then we'll move forward with the correct correct solution for you.
All right, guys, I should be up now. All right, sorry about that.
Any other questions right now on process?
You sharing this?
Yeah, I'm good.
Yes, sir.
Just what changed so that UHC could actually come into this market?
Interesting, yes. Yes, the question was, why is United Healthcare now in this market? There was a law in Minnesota that only nonprofit insurance companies could sell in the state. And so while it may not seem like it, your health partners, your Medicas, your Blue Cross Blue Shields, those are all nonprofit insurance companies. United Healthcare is a for-profit. So even though home office was here, a ton of employees are here, they couldn't sell here. So they did do some work with Medica. Medica utilized United Healthcare's network nationally. And so it was, once Minnesota changed that and kind of took the handcuffs off, United Healthcare came in and said, okay, yep, we have this build. Obviously we have the network. Medica, you've kind of, utilized a lot of our network in the state. And so that's why they were able to jump in right away, sign those contracts, and get started right away. So it was legislative. And talking about that, that's another reason we wanted to really look at United Healthcare. One of the reasons that, a health partners, may not have been as excited. I mean, they do have a lot of the market. And so is it worth them creating an association health plan if they've already got half or 2/3 of the groups in it? May not be worth that. With United Healthcare, they really don't have much of the market share. So that was our thinking in going forward with this, besides their knowledge and their history with association health plans, is that they're going to want more market share. So that was the reasoning, the method behind the madness of really targeting them.
And guys, I'm sorry, something's going on where security is blocking me. I'm trying to see if I can get this, how to go in the back way and see if this will work. So I'm gonna try and reset my password. I'm gonna try it through a different control now. Let's see if this will work from here. Okay. All right, so I'm kind of going in a little bit back way, and I'm not sure why the security is not letting me as an employee, but something to do with our connection and how I'm logged in is because I've got administrative access. But an employer is going to go in and start the process by putting in the basic company or basic employee information. So you can see here, there's some information. When I log in as an employee, I'm going to see what my information is, and this is where I can easily go in and change my date of birth or correct information if it's wrong, and I'm going to fill in blanks that that are needed. It normally would have a red asterisk showing that it's needed, but I'm coming in from administrative access, so it's a little bit different. But same feel.
You've used that one before.
Yeah. Let's see if this works. 1, 2, 3, 4. Should work now. Okay. And as I come down, here's my address. This is where I can correct if it's wrong. Too many digits. There, I'm typing a phone number in the Social Security. Here we go. 1, 2, 3, 4, 5, 5, 5, 5, 5. That should work. Okay, it worked. So I'm going to put in a phone number here because this would be. So normal basic information, the more the employer puts in, the less the employee does. There's, viewing it, but employers may not have a lot of this information or know about it. So this is how I add a dependent. This is a very simple process. So I'm going to quickly add my wife.
Better spell her name right.
Good to have dreams.
Yep. So the one time where I can have multiple wives without getting in trouble, right? All right. And so super simple, super quick, add a dependent. I could keep on adding it, if I had children. So a lot of employers don't necessarily have the dependent information at their fingertips or know about it, especially on a new hire perspective. So it doesn't take but a minute or 30 seconds for someone that, to add their dependents. So now I'm enrolling into the benefits. I'm an employee. I'm going through my enrollment for the very first time, whether it's open enrollment or as a new hire, and I'm going to look and see what the plans are. So this is going to be customized, per group. This is where the company can put a message. We can we have templated, information, but this is where the employer can, HR owner can put a customized message, of what they want to say. So I'm going to, decide I'm going to, cover myself and Jennifer. And so when I look at this, it's got the company name, the carrier name, the plan name. I've got access to all the SBCs, which are going to be the details. I can look up how to find a provider if I'm on a HMO. So here's the more detailed version of the SBC. But still, it doesn't tell me a whole lot. And so what I can do is I can click this button here that says compare plans. And it gives me a side-by-side comparison of the different plans that are available. And I can help make an educated decision of, oh, wow, this plan, I really like the price on here. Oh, this is an HSA compatible, no copays. That's not going to work for me, my family. This plan's going to be a little bit better, and so forth. So they get a chance to look at it. They have a chance to export to Excel. So they can get it, where they can look at it and maneuver the information a little bit easier. Due to my viewing, you can't see this fifth plan here, but there's a fifth plan that's available, to help make that educated decision. Yes.
Where is it that the companies put their information so that information is accurate based upon how much the company is pitching in, what they're responsible for?
Yeah. So when we go present we present the options to the group and they make it a decision, they're moving with this carrier, they're going to stay with this carrier, and these are the plans and rates, and they're going to give us the contribution. Our team builds all that. So from an employer perspective, we data gather some information. We have an intake process. Then we build it, and we create a test employee for the HR owner, whoever the person is of the company, to go through the whole process, start to finish, make sure it meets with their expectations of how it works. The numbers are all matching up, but that's what we're gathering on the front end. So Drew mentioned that there's a lot of, the composite rates, where there's a single rate for employee only, a single rate for employee spouse, employee children, or child or children or family. But in the age banded world, where groups have a different rate per person, our system takes that all in, and we load that in. So now employees are selecting the plan, and it's going to know their age, and it's going to know their rate amongst all the plans that are offered to them. So as you can see here, depending on what plan I pick, and I'm just going to go ahead and pick this plan right here, I'm going to have a running total of what my costs are going to come out on a per paycheck basis. This is specific to me and my family. So if I decide to, whoops, I'm going to say, you know what, my wife actually is going to stay on her plan through her coverage. I take her off. All the rates are adjusted on the spot. So it's a nice way is there's not that maze and that trying to figure out, what that, cost will be, for that, for me and my family. So I selected my plan. I'm going to move to the bottom. I'm going to move to the next.
Well, Jason, again, just for time's sake, we wanted to give you a history. We wanted to kind of show you, A, the intake, and Z, the employee experience. But there's a lot of things on the in between. It's our job to make sure you see the options. We consult and make sure you find the right options. We, help determine the contributions, and then that's when our tech team loads everything, and it's your particular, Trendex page. So that's, again, there's a lot in between, and we don't want to show you every single piece of that because you'd be here for hours and be bored. But there is a lot of pieces in between, but we think it's important administratively for you to see that first part and then this last piece.
Yeah, so I'm not going to mess with enrollment. So normally when it works, even when I'm talking, I'm not a great multitasker. I can get from A to Z in less than 5 minutes. Now, for someone that's not as educated in the benefits, is not their full-time job, it'll take a little bit longer, but they get to have access at their fingertips, the side-by-side comparisons. They're offering multiple plans, the access to the details. And what the beautiful part about that is, I'm in the insurance business, so from my household, I'm the one that makes decisions. But in any other decision in our household, my boss makes the decision at home. And so if I had to sit through an enrollment meeting and education of my employer and go take this information back and try to explain to her, I would fail miserably. But she has access to all this information at her fingertips online. We go through the process and we digitally sign all the applications. So then from an administrator standpoint and from a broker standpoint, we're gathering all that clean data. Some carriers require the applications, so we can submit the application. We can also push some buttons and get census data, get payroll deduction reports. We have that information at our fingertips. So the census is something that for those of you that don't put a census together every day, and then you have to, annually update it, and you've had a lot of turnover, a lot of changes. It can be, a multi-hour, project, or maybe in a couple of days trying to, put all the information in. By clicking a couple buttons, you have access to that census data. So this is a tool that you'll use throughout the year for new hires and terminations. Our system has connectivity to a lot of the non-medical carriers. So when a new hire goes in and makes an election, the system will speak to the non-medical carrier. United Healthcare is in a testing phase right now, and so there's chances that they'll be available. But if you're on the AHP program right now, it's part 2 of their project. So there's not that connectivity on the medical side today, but brings a whole lot of efficiency and clean data.
The question is, once they're committed to the program, do then all future hires, are they required to join the plan?
When you say join the plan, sign up for insurance, so they would have the rights to, if they're eligible, that they can decline coverage, just like it is today. So we don't force it. It's the same process they would have today. They satisfy their waiting period, and now they're eligible to enroll, and they make an educated decision. Maybe they have Medicare, maybe they have VA coverage, maybe their spouse works for a big conglomerate, and they get free insurance or better coverage. So.
But they would have access, and they would go through that portal as well, Steve. So that's something that can be used, as I think Jason referenced, throughout the year.
Can you share just a little bit about how people, if they wanted to use their current broker, and kind of the value of using you and your system, but if they don't, they're not required to leave?
Yeah, absolutely. Thanks for that. And we would love if you used Holmes Murphy, but we do recognize that there are relationships that are out there. So on the Wellmark AHP, if you say, gosh, this is all great, but I don't want to leave Bob, you can go through him or your current broker to get that AHP program. Now, all of the Ben portal, the administrative things, that's proprietary to Holmes Murphy. And again, we'd love to help you through the process and make sure that we create those efficiencies. But our goal and our pledge to Steve in the beginning was to help grow this program and help to grow PIM. So we want to do whatever is best. And so there's some things that, that we're doing to help PIM. But this is a piece, if you said, I do want to check out, with my current broker, that is something that exists.
Will we be posting the plans themselves so people can view those plans separately as part of our resource offering on the website?
That's a great question. Yes, we have a shell of that built. Just if you see one United Healthcare benefit summary is 20 pages long. We're not going to do that, but we have just a one-pager that highlights the 10 plans that are out there, and we can work with you to have those posted. Again, there's 7 PPOs, 500 to 6350, a few HSA offerings. So we think we have most of it hit for you. But yes, we can work with you to get that out there.
And Drew, behind you, I've got the side-by-side comparison. So I enlarged it to make it easier on the eyes, but it goes down a little bit lower. So from left to right, richest to least rich plan from a deductible standpoint. As you can see, from a $500 deductible, and then I think as we keep on going through, there's a couple HSA options.
HSA, so 3,000, 5,000, 6,350, and then a little different type of true traditional plans. These blue ones that are over on your left side, they're kind of a different type of animal, something United Healthcare is doing. But the primary care physicians are $0, unlimited, but your specialists are $100. So they're trying to shake up some things. Specialists are costlier visits, and they want to drive people toward primary care physicians, so they have that. Most of these plans have free primary care office visits for those under age 19. Many have free virtual visits, the telemedicine benefits. So there's a lot of bells and whistles with these plans. And again, we can't put every detail out there, but this will give you an idea of what these plans look like.
And as Drew was talking about that plan, that may not be, $100 specialist could be scary for some people, but offering multiple plans and meeting the needs, there's a lot of your employees that may check the box for the cheapest plan offered, and they go to the doctor once or twice a year. So a plan like that may be super exciting. But if I'm engaged and I've got a few conditions I'm getting treated for, and I'm going to my specialist, 3-5 times a year, that may not be the right plan. So you don't have to pigeonhole everyone into one plan. You can offer multiple plans. If you're doing that today, we can continue doing that. If you're not, being able to do it on a technology platform, makes it a lot more streamlined where they can see the side-by-side comparison, click buttons, move around, see what those costs are. So I know, Steve, are there any other questions or Ben online?
Nope, that's it.
From you guys, any other questions?
I know it's drinking through a fire hose, but we have built this. I think there's a good strategy to really help you cover the market and give you something extra through the United Healthcare program. We're excited. Jason and his team have developed this Ben Portal initiative. And I think that will be a difference maker for a lot of customers. So, and again, on that, no matter with your United Healthcare AHP or, work through Holmes Murphy on a different plan, that's something that you're going to receive at no cost. So we're truly thankful to you, Steve, and your team for helping us, letting us help you get to this point. And we're hopeful that we've made this process easy enough and understandable enough to everyone here and online that you'll be able to kind of start that process and help us gauge the success of the program.
So the simplest way to explain the next steps, though, is for people to go on to, the website. There's a redirect on the website. If you just go to pimw.org/health+, you'll go right to the site, or it's pimw.benportal.com.
Yep.
And then you're going to upload your data, or you're going to enter your data, and you're not obligated to the system. You're not obligated to the insurance. You're just going to then review and see whether this is going to be right for you.
Yes, exactly. That is our hope for the next step, that you'll take that into consideration and put your information out. See the process and see what the best fit is for you. Absolutely.
Oh, another question here. Does the employer set up which plans the employees can pick from, or do they get to pick from all 10 no matter what?
That's a great question. Yeah, Ben said that, do they get to pick from all 10, or do the employer choose? Employer will choose. I think the number is up to 5. They said. Our recommendation is probably keep that to 3. You don't want too many, or else it gets confusing and it goes to the whatever's the cheapest. There's too many in front of you. But you do have the opportunity. Yes, you don't have to choose just one, and you won't have access to all 10. And we'll help you come up with, really the best fit, the best mix of plans.
And I've kind of put up here, we've got this FAQ. It may be straining your eyes to read it all, but we'll get this on the website so you can look at it. But this is something that we are continually updating. I believe it's 2 pages. So this kind of gives you an idea of a lot of the information we cover today in our presentation is on here with some details. So as you drive back and forget some of the information you may have shared, you'll have access to this online. Our team will post it within the next 24 hours.
There are a couple more questions. Does it matter what size of an employee you are regarding how many plans you can offer employees? Is that up to 5, dependent upon?
Yeah, for every parameter they've given us, they've said up to 5. Now, I mean, if you have 2 or 3 employees, I don't know that, again, that you'd want to do that. But yeah, you would have the opportunity to offer those, no matter what size you are.
And for GRX quoted rates, don't they need to supply social security numbers on all employees and dependents?
No, we don't need social.
Yeah. But we do need all the employee information or the dependent information.
Yeah, names. It's the standard names, date of birth, gender, and then it'll also require the home zip code of the employee.
Now,
So
you had a spreadsheet there that had some particular fields on it. How do people access that spreadsheet if they need it?
So when we get their information and we go to market, they'll be getting those plans and other plans in our proposal for that.
So,
Or are you talking about the census?
I'm talking about the census when they upload the data.
Oh, yeah. So I gave you guys example under 5, but if you click the button that's over 5, there's a way to hit download the census template, and it'll be the format that works in our system. But once again, if you have that data in a different format, don't spend the time putting it together. Our team, massages Excel data and census data on a daily basis. So they're pretty efficient, way more efficient than I am. So we can take that burden off of you guys. So if you have one generated, and we want to make sure it's accurate that you send us, and we'll put it together and we'll come back and say, oh, we're still missing this. So we just got a census in that format for one of the printing groups that just came in, and we're missing some of the dependent information. So we'll go back and say we need this information for them.
Great questions. Any more? Okay.
Again, thanks. And Steve, feel free to share our information if they have specific questions.
Absolutely. We'll get a note out to everyone afterwards. We'll get the recording of this conversation in the next few hours. We'll have that posted by the end of the day, so you'll have access to it. And then we'll continue to be in touch. You will send us your questions whenever you got them, and we'll be on our way. Thank you so much for coming. Thank you, Jason and Drew. Appreciate all your time.
Thanks, everyone. I appreciate it.
Thank you.
Good to meet you. Yeah. Thanks very much. Thanks. Good to meet you. Good to meet you too. Thanks so much. Go back. Okay. So. Okay. That's going to be Jason.
Yes.
There's going to be a couple options. If you want.
Thank you so much, guys.
Thanks for coming.
Thanks.
Appreciate it.
Yeah.
Yeah, thanks very much.
Thank you.
I just got
If
you
we
know that.
have staff health here, you know, working for me.
Okay, perfect.
How likely.
Jason, take care back.
So, the big question is ongoing.